Ladies and gentlemen, welcome to today's webinar. Today's webinar topic is from our first 30 minutes series. Today's topic is expanded rules help doctors get paid for telehealth work during coronavirus emergency. Our presenter today is attorney Eric Boughman. If you'd like a copy of today's presentation, you'll find it in the handout section of the webinar interface. There's also some additional handouts there that you may want to take a look at while we go through the webinar. With that, let me hand it over to Eric. Go ahead, Eric.
All right, thank you, Tony. Good afternoon, everybody. Thank you for joining us again. Hope everyone's doing well out there while we are in the midst of a national emergency. Thank you to our healthcare community for everything they're doing. Thank you for joining us today. With that, we've got another session here for our first 30 minutes, and we're going to talk about some recent changes. Originally, we were going to do a general telehealth update in light of some recent changes to Florida law from earlier this year, but the last 2 weeks has seen a whirlwind of changes and has really broadened the ability of healthcare providers to get paid for services across a pretty broad spectrum from a licensing standpoint and from a payment standpoint. I first thought about doing this webinar as a little bit of background when talking to a physician who had remarked about 2 weeks ago, as this was all starting, that he was starting to keep people out of his office and essentially dealing with patients remotely, and a lot of older patients who aren't too tech savvy, maybe didn't fit into the very narrow definition sometimes of patients who can be seen and for which reimbursement can be made under, especially under the federal authorities under Medicare. And he'd seen a number of patients and done a lot of work, but wasn't able to get paid for it. Well, now what we've seen in the last 2 weeks is some rule changes that change that entirely. So I'm going to move us through today's webinar. In the next 30 minutes, we'll cover a broad overview of the major changes that we are seeing. If you have questions, I'll try to address them as we go along or at the end. If you have a question that I do not get to or am unable to address during the webinar, let's do a follow-up, maybe a call or an email. Shoot me an email. You can always reach out or reach out by phone. Right now, human contact is welcome. Here's a little overview of our agenda for today. I'm going to give you a background on telehealth. Again, there was recent changes in Florida law earlier this year, and that in itself is worthy of a discussion as far as who can provide services and how they can be provided. But now we've had a number of issues that we've seen come about due to this COVID-19. And we've got, the two main issues we'll talk about is licensure and the effect on payments. And it's federal payers and private payers. And then wrap up with a few questions at the end. So telehealth generally, you'll also hear the term sometimes telemedicine. That was used in Florida law for those joining us in Florida. Some states still use telemedicine more frequently. Telehealth is generally considered to be a broader term than telemedicine. Telemedicine focuses generally on, oftentimes on the medical community, specifically where telehealth is broader, providing services from a alternative treatment standpoint, psychiatry, counseling, other services that may not be considered directly medical in nature. But always the idea of telehealth is that you're providing services from a remote location, services provided by healthcare providers to their patients, and it's a synchronous or asynchronous communication. That just simply means that it's a simulcast, essentially, through synchronous communication, or asynchronous, that's like a store and forward. You send a video or send photos. You may do this, for instance, in reviewing x-rays. The new statute in Florida that was adopted earlier in 2019 is 456.47. That's the basis from which we start looking at telehealth in Florida as far as licensure. Important to note that that statute specifically states the communication cannot be by phone, email, or fax. And you'll see that again repeated in a lot of the language from the payers under Medicare, which is it has pretty narrow definitions of what they'll reimburse for telehealth services. Traditionally, you had to use secure communications from a specific site. The patient had to go to a originating site and get on a video camera system There's a number of providers for those, but get on that system and communicate with their provider through that communication method. And then the provider would be at a remote location. There was also significant limitations in that those services could only be provided from essentially rural areas or designated shortage areas for healthcare. And now that has all been broadened. Prior to the last couple of weeks, most people could not sit in their home. And as a lot of folks know around the country and here in Florida, where we are, we're under either orders or recommendations from the federal government and from local authorities to stay in our homes and not go out as much as possible. So how do you get healthcare services while that's going on? Well, this is part of what these changes have addressed. So while we could traditionally not deliver these services by fax, email, or phone, now that has all been substantially relaxed. This next slide, I'm not going to read these to you, but you have it there for your information. This is a non-exhaustive list of folks who can provide services by telehealth, at least in Florida, under the telehealth statute that was adopted. So it's a pretty broad group. Some of the changes that have gone into effect just recently will be more limited. It won't affect necessarily everybody who's in this list. It's directed more towards the medical community that's necessary to deliver either services in support of the COVID issues that are going on, or to provide regular medical services that would be may not be considered urgent or medically necessary at the moment, but people still have issues that are happening from a health standpoint while we're dealing with all of the COVID issues. And so a way to treat those people without having them come into a clinic or without having them go to a facility is to have them stay at home and have have physicians and other providers treat those folks. On the next page, we're going to show you here some of the other folks who can provide services by telehealth. And other than the specifically listed practitioners that were on the previous slide, anyone who's licensed under a multi-state compact, and there's a nursing compact, there's a few of those, they can provide services. And the new statute provided a fairly straightforward mechanism by which out-of-state providers could provide telehealth services in the state of Florida. General requirements for that, it's a no-fee application, and you have to have an active unencumbered license with no issues for the past 5 years, and essentially demonstrate the same financial responsibility as an in-state practitioner. Letter of credit or insurance, that would be $300,000 in the aggregate or $100,000 per claim. You have to designate a registered agent here in Florida, and you can't have a Florida office, so you must deliver those services only remotely. Those rules have been relaxed somewhat, again, in light of the what's going on with COVID. So for folks who are not in Florida but might be able to provide services, if you are a practitioner who would be essentially, if you would meet the eligibility requirements to provide services by registration as an out-of-state provider under the Florida statute, you are likely able to provide those services right now, even though you have not registered. You'll still need to meet the financial responsibility requirements. You'll still need to work within your scope of practice, but you can provide those services without actually registering right now. And that's due to a recent declaration of emergency in Florida and a DOH order that we'll talk about. Other exceptions to the telehealth statute is in cases of emergency, or where an out-of-state provider is consulting with an in-state provider who has final authority. Here you see these statistics most recent when I pull up the numbers, and part of the telehealth statute, the new statute, it specifically states that anybody who registers as an out-of-state provider will be listed on the designated telehealth website. And if you're interested in getting that contact information or the address for that website, shoot me an email and let me know, and I'll get that for you. So we'll move on to our next slide here, where we start getting into the changes. And I'm working in the office, but on a remote computer. So if you see my pointer moving around, I apologize for that. If it's distracting, I'll try to keep it out of the way. All right, generally, how can services be performed? A lot of the services that you would be able to perform in office, as far as evaluations for diagnosis and treatment, can be performed by telehealth, provided you meet the requirements. And there's some other stipulations that we've listed here on the slide. Take note of prescribing controlled substances. There were some limitations there. They've been modified by what we've seen recently. The medical records requirement for any telehealth provider outside the state, you have the same requirements as any provider in state. But note the prescribing issues, because that's going to be affected by our DOH order that we're going to talk about. So these are the issues in light of what we've seen in the last couple of weeks that providers are facing. So when I talked about in the beginning there, the physician that I was speaking to talking about delivering services where he wasn't able to get paid for those services or be reimbursed from payers, some of the issues that create limitations are location. Under many payer rules, you are limited in the location from which services can be provided and where they can be delivered. So the patients, as I noted under Medicare, have to be in a designated facility for telehealth services. They couldn't be at home and receive those services. Another substantial limitation is on the mechanism of communication. Especially older folks may not be as tech savvy, or people may not have access to the proper equipment in order to communicate with their provider in a secure fashion. There are HIPAA and security and privacy concerns that come into play. And so it was traditionally considered a no-no, or it has been up until the last weeks considered a no-no, to deliver telehealth services via an unencrypted source of communication, such as a regular smartphone or video conferencing through FaceTime or some similar mechanism. You had to have a secure communication link. Again, that has been relaxed. In fact, Department of Health and Human Services Office of Civil Rights, who enforces HIPAA, has come out with a policy memo just recently, specifically stating that they are relaxing the enforcement of HIPAA with respect to communication as long as providers act in good faith. The services that can be performed, it's sometimes limited services, depending on whether it's Medicare, Medicaid, or private payer, and also depending on what the statute would allow. So there's another limitation, and of course, payment itself. Limitations on payment, inconsistencies with respect to payment. Some states outside of Florida have statutes that call for payment parity, essentially that a provider of telehealth services should be paid the same as a provider of services delivered in person. Florida does not have that statute. We do have a statute, but the statute in Florida essentially leaves that open to negotiation between the provider and the payer. And the only stipulation there is that where there's a distinction between what an on-site provider would be reimbursed versus a telehealth provider, if there's a distinction in the payment, that provision of that contract has to be initialed by the telehealth provider. So they definitely have notice of it. I put a note here on federal action as well. I only put this here, and I haven't had time to do much research on this, but I thought it was an interesting point when Mike Pence apparently a few days ago, and forgive me, I don't watch every press conference. I do follow the news, but I follow different news sources. But I'm aware that Mike Pence a few days ago made a comment about opening up telehealth nationally and expanding those services. And there's been some discussion of whether this will be just a temporary service or whether it will last for the long term. And that brings into question the authority of the federal government to essentially weigh in on issues of licensure and payment for private payers, or issues of licensure where the states have traditionally been the controlling authority. And that's an unanswered question right now. A lot of folks will tell you, well, the federal government has no jurisdiction to tell states how they can license providers and license telehealth providers, and whether they need to participate in a national telehealth system. I think it's an interesting academic question, maybe one that we'll cover after this whole thing is over. But my initial thoughts on that is that even if the federal government, one, I wonder whether they have authority, whether they really don't have authority if you're talking about an issue that affects interstate commerce. But the other issue is right now there's a lot of money, and so we're going to see this in a minute. Is in addition to the Florida Declaration of Emergency, we had the federal emergency declaration and the original federal bill that provided for $500 million to support telehealth services. This is before the CARES Act, and the CARES Act now has codified some additional issues. So there's additional money that's been put out that's made available for facilities to provide telehealth services around the country, and now that money is being distributed. And similar to the highway system, how that got done, and drinking laws and other laws where the federal government technically doesn't have authority because the rights are reserved to the states by Constitution. I wonder here if the federal government will have the ability to use, essentially use the purse strings of the money that is designated for these services to convince or persuade the states or pressure the states into adopting a more open system. So this will be an interesting issue in another couple months to talk about generally on what the effect is of what we're going through now, how it will affect delivery of telehealth services long term. If anybody has thoughts on that, I'd love to talk to you about it. It's currently an issue that's really just being kicked around in speculation. But I thought it was worth mentioning. I'm not aware of any specific authority right now that the federal government has to mandate that every state adopt telehealth services across the board, but payment is often a strong factor in that regard. All right. So what are the changes that we're seeing? First of all, licensure. How are services that telehealth that providers can provide being expanded by what's going on? We first saw this in Washington, where Washington essentially had limitations on who could provide telehealth services, and when they were starting to see a rise of COVID cases, they felt the pressure to offer the ability for out-of-state providers to volunteer their services in state. So as far as I know, Washington was the first state to come out and say, look, we're going to relax our telehealth standards so that out-of-state providers can help us out with what's going on. We saw other states follow that. Massachusetts issued an order, and then Florida issued following the governor's declaration of emergency, then the Florida Department of Health issued this order here on March 16, 2020. So this is just about 10 to 12 days ago. And it was authorized by the governor's executive order, and it essentially allows healthcare professionals from other states who aren't registered as telehealth providers in Florida, they're not among the 604 that we mentioned earlier, to provide telehealth services, or it's provided they still meet the general requirements. You have to be licensed, you have to be operating in your scope of practice, you have to meet the financial requirements, and your license has to be unencumbered. But there's a number of provisions in that executive order that have been relaxed. And so in addition to relaxing who can provide the services, we've also seen there's relaxed standards for temporary waiver. It's 30 days essentially in the order unless it's extended by the Surgeon General. A 30-day, essentially a moratorium on enforcement on some laws pertaining to prescribing controlled substances. That's directly addressed in the telehealth statute. It's quite limited. The DOH order broadens that. Also, the issuance of medical marijuana certification has traditionally had to be done by a physical exam, and that has been relaxed under the DOH order. And then prescription drug standards are relaxed to make sure that folks who need prescription drugs for specific treatments are able to get those drugs prescribed by multiple methods of telehealth. I believe I have dropped, or we've dropped a copy of that order if you're interested in seeing it. In fact, you may even have my highlighted copy. It's pretty new, and so probably a lot of folks, if you have healthcare clients, are probably aware of this, but for some of the smaller private practices and small practitioners may not have seen this. It's worthwhile, and I would encourage you to share this with your in-state and out-of-state folks. All right, so beyond licensure issues, we've got, of course, payment and reimbursement. So the big one here is this March 17th order from CMS that has made significant changes on what Medicare will pay and reimburse for telehealth services. As I noted earlier, there were substantial limitations on what was available under Medicare, but when the president issued an executive or made an emergency declaration, that opened the door for CMS to then use its waiver authority to make some changes to deal with the COVID-19 emergency. The basic changes that we see there is extension of coverage to beneficiaries wherever located. So not only does it cover beneficiaries who are not in rural areas, but it also covers them in their own home. So now patients can be recipients of telehealth services while they're at home. And in fact, I'm going to do that next week. I have a follow-up. Anybody who's been on previously knows I recently had shoulder surgery, and I'm going to have a follow-up on my shoulder surgery next week, and it's going to be by a telehealth appointment, and we're going to do that one by FaceTime. And that leads me into another significant change here of what CMS has come out with. And they will now extend coverage to services provided by smartphones and less secure, I won't say unsecure or insecure, but less secure video conferencing modalities like FaceTime, Google Hangouts, I believe is another one, even telephone. The key here is that CMS has said that they will provide reimbursement, and OCR, who enforces HIPAA, is going to relax enforcement standards so long as the providers act in good faith. So if you have a client, or if you yourself are providing telehealth services, or you're trying to provide services to a patient who doesn't have any means of communication other than a telephone, well, then a telephone is under these circumstances likely going to be deemed good faith if that's the only way that you can communicate with your patient. So in addition to what CMS has announced as significant changes to what is reimbursable, the biggie here is that they'll reimburse anybody for services. Now my appointment next week is not going to be, it's not a Medicare appointment, but that's a big deal. I can now be at home. I don't have to worry about going out anywhere, going downtown, and see my doctor, have the appointment with him, get the required follow-up. I expect he'll probably from there write a prescription for changes in my physical therapy, and that's all going to be done without me having to go into the physical location, and I can abide by the social distancing policies, rules, and laws that are currently in effect. I put a couple notes down here in addition to what CMS has announced. HHS and OIG, that's the Office of Inspector General that has enforcement authority. They have announced that they will relax pre-existing relationship requirements. So traditionally with telehealth and Medicare, you had to have a pre-existing relationship between the provider and the patient before you could be providing and being reimbursed for those services. That's now going to be relaxed, and cost sharing. As many people know, if you waive co-payments or if you waive deductibles, that can raise regulatory concerns under the anti-kickback statute or the civil monetary penalties beneficiary rule. And now with those being relaxed, people are able to actually get telehealth services without having to worry about their co-payment or deductible. And different schools of thought on that. I'm not here to make a judgment call on it, but certainly I know we want people, if they think they may be affected by this virus, I think we want them having at least contacting their healthcare provider. Much better that they do that by phone than trek into a hospital emergency room or some public place where they're going to put other people potentially at risk. I know I'm happy about that. Again, I put a note here that on the OCR memo. I may have included the OCR memo in the materials if you're interested in seeing that, but essentially it says we're not going to be very strict on HIPAA standards while the emergency is going on. And some of these items, the CMS announcement, I did drop another handout for you in the materials that you can download. That's an article that I wrote recently on my blog, the blog that I edit, and right on where I talked about these changes right after they came out from Medicare. If you want more details on the effect of those changes, you can take a look at that article or visit the blog, or you can shoot me a question. Some of these items here that have been announced with the relaxing of standards are now being codified within the CARES Act. So put a note there for that as well. All right. Beyond Medicare, you have Medicaid. Not as broad, but Medicaid does cover over 3.5 million people between Medicaid and the children's services here in Florida, over 3.5 million people and 64 million US wide. And ACA, following in the footsteps of Medicare, has announced broadening of coverage for Medicaid services here in Florida. And there's 2 alerts. I believe I put the second one in your materials. If you're interested in getting a copy of those and you can't download it, let me know and I'll make sure you get a copy of it. But the 316 alert expanded COVID-19 coverage generally. The 318 alert addressed telemedicine for both medical professionals and behavioral health providers. So another big area right now, a lot of people are struggling with, how to deal with the crisis, how to deal with loss of loved ones, how to deal with loss of employment, being home with your family all the time. There's different challenges that come up with everything that's going on. So now, as much as ever, probably a good idea to have people be able to access counseling and behavioral health services in addition to medical services. So Medicaid's going to cover that according to their recent alert. That 318 alert came right on the heels of the one on March 17th from Medicare. Okay, what are the private payers doing? As I noted earlier, Florida doesn't require payment parity as the statute sits now. On March 19th, because especially with what's going on with Medicare and Medicaid making announcements, there's been a push to have the private payers agree to expand their services and relax their standards so that people providing services can get paid. So again, using myself as an example, I have an appointment with my surgeon next week. I also have been going to physical therapy. And right now, my physical therapist is agreeing to see me via a telehealth appointment. I'll still need to do some in person, but some of the follow-ups just for maintenance and monitoring, we can do via video conference. And even right now, they're not sure if they're going to get paid for the service beyond whatever I pay them for a copay. And frankly, that just seems a little crazy right now. If they're doing the work and they're going to continue to see patients, they should be compensated for that. On March 19th, the Florida Medical Association sent a letter to the Florida Insurance Commissioner asking the Insurance Commissioner to mandate payment parity among private payers while this crisis is going on. And right now, it's on a case-by-case basis. So some providers have announced that they're expanding standards. I'm still sort of getting up to speed and trying to figure out who's said what. But Florida Blue has expanded access. United Healthcare has noted expanded access. Just for the heck of it, I've called my own insurance provider to see if they have any specific statement to make, or if there's been any expansion. And they really didn't have any information when I called them. So this is still in the works. But if you have any questions about that, or if anybody has more information to share on that, I'd appreciate it if you would share that. If you have any questions, shoot them to me. If I get updates on that, I'll be happy to share that information, particularly any response to that letter to the Insurance Commissioner. Okay. With that, thank you for joining us for this half hour again in our first 30 minutes session. We will do these routinely. We've been doing them and we'll continue to do them. Our focus now is going to be on issues that are coming up in dealing with situations that we're dealing with right now. So next week, we're going to do another session. That one's going to actually it's going to take a little bit different course. We're going to talk about, a lot of the healthcare providers right now are going to be busier than ever in dealing with coronavirus issues, but those who aren't, some private practitioners who just see patients in office, or maybe alternative providers or dentists, orthodontists. There's a lot of non-essential or non-emergency, I should say, services that are now being halted, and this is going to affect people's business. So if you can't provide services by telehealth, what kind of situation are you looking at if you go for several months in a financial decline? And so next week we're going to talk about some structuring and asset protection issues with respect to the medical community specifically, but those issues will apply to other folks. At least there will be some overlap with other folks as well. So next Tuesday for an asset protection discussion, in the age of coronavirus. And with that, I don't see any questions, but I'll double check if anybody does have questions. If you didn't get a chance to get them to me during this discussion, and you want to shoot me an email after the fact, my email and contact information is at the bottom. Please send it there. You can also feel free to reach out by phone. I will get your call, or I'll get a message and I will call you back. And that's our half hour for today. Thank you again for joining us. I hope this was helpful, and I wish you all the best as you continue to weather the storm that we're all going through. Thank you, and have a great rest of your day.